Assalamu alaikum wa rahmatullahi wa barakatuh. Good evening, ladies and gentlemen, and welcome to another episode of Up to Date. I'm the host for the evening, Wael Al-Anizi, and with me here today in the studio is Dr. Anas Al-Khani, who's a medical intern at the Kingdom Hospital. Dr. Anas, first of all, I would like to welcome you to KSA2 and to the show Up to Date.
Thank you very much. It's always an honor to be with you.
And of course, today we have a very interesting topic that we will be discussing, advances in laparoscopic surgery. But before we get deep into the subject, I just want to ask you, Dr. Anas, being a medical intern, what does this exactly involve?
Being a medical intern is just a very high responsibility. You're always responsible for taking care of the patients. You're always the first line or the first person who takes care of the patient and then report to your seniors. And therefore, it's a very interesting part in your medical career. However, it's also very stressful. So you need to always make a balance between both and make sure you're taking well care of your patients and at the same time doing your job properly.
I think right now, in about 4 months' time, we're going to be approaching summer. And it's at this point that a lot of students decide on the major that they would like to study, and that will obviously reflect and have an influence on their lives. For people that might consider becoming doctors, do you have any advice? I mean, becoming a doctor is not an easy major.
True. Yeah, I would highly recommend before they go into medicine to think about it really deep, because going into medicine is a very high responsibility, as I mentioned. You're taking care of human lives. And you should be always aware of what you're doing. You should always know what to do and what not to do. And at the same time, you should always take into consideration that you need to balance between your life and your patient's life. So I would say that it's a very big decision. So consulting your family as well as your doctors or anyone you know in the field would be really helpful in that.
Well, for you personally, Dr. Anas, coming towards the end of your studies as an intern right now, do you think that the benefits greatly outweigh the pressures of the actual studying?
Definitely. Medicine is a noble field that you work in. Dealing with the human lives and with human souls is a bless. Sure. When you feel that you relieved someone from his pain or you helped someone coming back to his normal life, this is by itself is a bless. You feel blessed and you feel happy. And I would say that, yes, at one point when you see someone smiling, when you draw a smile on a mother's face or a father's face or a family, you feel satisfied. You think that, yes, you're paying off, even though regardless of the financial outcome, anything else. We're talking about just the feelings, the emotions that surround medicine. And therefore, yes, I would say it would definitely pay off.
I hope that you put a lot of smiles on people's faces in your future. And of course, as I said at the beginning of the show, today we're going to be discussing advances in laparoscopic surgery. And we have a report prepared on this subject. So let's go to this report and we'll be back. Stay with us. I think they're preparing the report right now.
It's important to remember that of the several screening methods, only colonoscopy allows your doctor to view the lining of your entire lower gastrointestinal tract. Colonoscopy is capable of detecting inflammation, infections, ulcers, diverticulosis, It's important to remember that of the several screening methods, only colonoscopy
We are back on Up to Date. In that report, we saw some of the technical terminology of laparoscopic surgery. And of course, Dr. Anis is going to try and shed some light into this subject and talk to us briefly about it. So could you tell us in very easy terms, what exactly is laparoscopic surgery?
Definitely. We know the traditional surgery that everyone knows when we have an incision or an opening in your abdomen or tummy, let's say, that ranges from 8 to 10 centimeters sometimes, or even 12. In laparoscopic surgery, the difference is that we have multiple openings, each ranging from 0.5 to 1 centimeter, rather than having one big opening that's 8 to 12 centimeters. And this, of course, the benefits of this is that it makes it easier on the patient to recover quickly, more quickly, and with less pain. And therefore, and also you decrease the risks associated with any other surgery, open surgery. However, this doesn't rule out that sometimes you still need to do the classical type of surgery. Now, to go more into details of laparoscopic, in laparoscopic surgery, we have different technique than the open surgery. In laparoscopic surgery, we use a camera, and we insert the camera into the abdomen, and we inflate the abdomen with gas in order to have a clear view of what organs inside we have. And then we insert instruments, each from a different port or opening. As I told you earlier, we have 5 openings, 4 to 5 openings, each ranging from 0.5 to 1. And in each opening, we have an instrument inserted into this. And therefore, the surgeon, what he does is that he manipulates to do the surgery that he would have done in an open procedure with these instruments. And therefore, not making a very big opening and making the life of the patient easier later on, as well as decreasing the risks of open surgery.
Well, what kind of surgeries is this usually used for?
Okay, that's a very good question. Well, mainly abdominal surgery, classically the gastric surgeries, and also gynecological, which are associated with women's health. That's to make it easier. Gynecology is the study of mainly of women and women's health. Mainly, we use the laparoscopic surgery and techniques to perform either on abdominal surgeries, anything within the abdomen, like the stomach. We do gastric sleeving, if you heard of it, gastric banding, or gastric bypass. Also, removal of the gallbladder, which is called cholecystectomy. And also, we do all gynecological procedures we might have done with also laparoscopy.
Well, how advanced is laparoscopic surgery? Is this a new trend, or has this been going on for a long time?
It has been going on now for almost 10 to 15 years. Of course, through this time, it has become highly advanced. And as we know, today everything is just in 2-3 days. We hear of new technologies and new findings. Laparoscopic surgery has highly developed over the past 10 to 15 years. Now we have something called the Da Vinci system. And this is a very high-tech laparoscopic platform that makes it even easier. I mean, as you can see, we developed from open surgery into now something called Da Vinci platform that makes life much more easier for both the surgeon and the patient.
Right. Well, when a patient goes to a doctor, are they given 2 options, whether to go and do a traditional or the surgery the regular way, or a laparoscopic surgery, or is this only available in some places?
Okay, that's also a very good question. I would say that it depends on 2 things. First of all, we have the patient's health. This is our #1 priority. And before the patient deciding what surgery he would take, we would recommend what surgery best suits his case. Because sometimes laparoscopy is very well for his case. However, other patients are not candidate for laparoscopy. And therefore, you need to do an open surgery in order to have better outcomes for his health or her health. And therefore, it's mainly the surgeon's recommendation first, and then comes the patient preference, of course, which is his decision at the end. But as I told you, you need to weigh some benefits and risks, and therefore the surgeon will decide which one suits this patient or this patient.
Right. Well, what are some of the risks that patients need to be aware of?
In laparoscopy,
yes.
Okay, in laparoscopy, the main risk we have is, as I told you about the technique, we need to insert ports. And when we insert these ports, sometimes we do it blindly. So, but in a specific technique, while doing these insertion of these ports, we might damage some of the adjacent structure. However, this is a very low risk. I mean, it doesn't really happen in very high percentage of your patients, just to take into consideration. But yes, it's one of the risks, a very important risk. Mainly, this is the most important risk, other than risk associated with any type of surgery. As you know, we have all types of surgeries, and laparoscopy covers a very big umbrella of surgeries. So each surgery has its own complications other than this.
All right. You mentioned adjacent structures. What exactly is this?
Yeah.
I'm guessing it's something in the body.
Yeah, definitely. When I say adjacent structures, when you go into the abdomen, you might damage organs. You might damage the viscera. The viscera is the stomach or intestines sometimes, which are all, the intestine is floating in the abdomen, therefore it might be anywhere. Also, you have nerves, blood vessels. All of these are adjacent structures that you don't need to damage, and therefore sometimes it might happen that you damage these. But as I told you, eventually the risks of laparoscopic surgery are less when available than open surgery. So when you can do a laparoscopic and this patient does fit laparoscopic, you would prefer laparoscopic surgery over open surgery.
Does treatment differ from doing a traditional surgery versus doing a laparoscopic surgery in terms of the duration and in terms of the actual opening in a person's body?
Yeah. Now, I would say that in laparoscopic surgery, the surgeon takes more time to finish his surgery. Okay. But eventually the patient, he will have a quicker recovery time. Wow. And he will go back home sometimes the same day or the next day if no complications are there. So for the patient, it's less pain, faster recovery, shorter hospital stay, and less infections. So as you know, we all hear of patients who had infections after their surgeries. And in laparoscopic surgery, since you're having small incisions, you're exposing small part of the body to the environment rather than exposing a large one when you do an open surgery.
Are there instances where the patient's condition does not allow for the performance of laparoscopic surgery? Perhaps if someone has a certain disease or a certain condition, and what are some of those conditions?
Yeah, there is, of course. For example, I would give an example to make it easier. When we have a patient with a colorectal cancer, let's say, okay, cancer in the colon, sometimes if it's highly diffused and the cancer is everywhere, sure, we can do laparoscopy because laparoscopy gives you just a limited view. The surgeon would rather do an open surgery, make sure he's taking out all the affected parts and then continue, rather than having a limited view and maybe leaving some remnants inside of the cancer. So therefore, to have a better therapy, sometimes the surgeon would decide to go on open surgery.
Is laparoscopic surgery very common in hospitals in Saudi?
Yes, now it's very common. Almost every secondary hospital in the kingdom has it. Here in Riyadh, private and governmental sectors both have it, and it's becoming widely spread. People are, now the population in the kingdom, they are aware of what's laparoscopic surgery, most of them. They come seeking. When they have a surgery, they do ask, is this a laparoscopic surgery? And this is very good because we need to increase the awareness about laparoscopic surgery versus the open surgery to make sure the patients or the population is receiving the appropriate treatment for them.
So you do think we have enough awareness about this form of surgery?
Yeah, definitely. I would say in Riyadh, as far from my experience, yes, most of the people I've seen, they know about it. However, we need to explain more and more details about the techniques, the risks, to make sure they're aware. This is their rights, and the patient's rights to know everything.
Do you think that the majority of patients prefer performing surgery in this way versus the traditional way?
Yeah, definitely. If it was me, I would say, or any member of my family, yes, I would go for laparoscopic surgery because of the less risks and also because of, as I told you, the faster recovery, less pain, the lower complications. And therefore, yeah, I would guarantee that they would have better outcomes of this surgery rather than having an open surgery if they fit into the criteria.
Wonderful, Dr. Anas. A minute ago, you talked about the Da Vinci surgical system, and I think our team has prepared a report on this. So let's go to that report, and when we come back, we'll discuss it in detail. Stay with us.
It's important to remember that of the several screening methods, only colonoscopy allows your doctor to view the lining of your entire lower gastrointestinal tract. Colonoscopy is capable of detecting inflammation, infections, ulcers, diverticulosis, intestinal narrowing, colorectal polyps, cancer, or other problems that may be present. The procedure is performed using an endoscope, which is a long, thin, flexible tube with a light and a tiny video camera attached to the end. The camera transmits images to a monitor, allowing the doctor to see the inside of the colon. In a sigmoidoscopy, the endoscope reaches only to the top of the descending colon. In a colonoscopy, the endoscope reaches through the entire length of the colon, where it connects to the small intestine. Most colon cancers are found in the first part of the large intestine. Many others are usually found in the last part of the large intestine, or rectum. But colon cancer can occur anywhere in the large intestine. These cancers are referred to as colorectal cancer.
Was Dr. Anas Al-Khani, medical intern at the Kingdom Hospital, and in the report that we just saw, we saw an explanation of the Da Vinci surgical system reboot works. And I think some of the terminology that was used in that report was a little bit extensive, and we're going to get an explanation from Dr. Anas. So Dr. Anas, I think you owe us an explanation.
Yeah, the Da Vinci surgical system, mainly, it's a highly advanced surgical platform. As we talked earlier about the laparoscopy, it makes laparoscopy easier. That's what it does.
Okay.
So it's a platform equipped with mainly sticks that the surgeons can use in order to perform this surgery in a better way.
When you say sticks, you mean like a screen and there's sticks?
I will explain it in full detail. That would be better. It's a platform where the surgeon sits at one end and the patient sits at one end, where he's sleeping, of course, and we're operating on the patient. Above the patient, we have 4 arms. Each has a specific function to do. However, one of them is a 3D cam. And this 3D cam with the arms will go into the patient, and the surgeon on the other end will have a 3D view of what's going on, and he will have something like an analog stick. Well, the one similar to our, let's say, for example,
like a PlayStation
yes,
joystick.
PlayStation or video games that we have, and he can manipulate what to do in the patient using these sticks. What's the advantage of this over having laparoscopy, which I talked earlier about, is that the manipulation of the instrument is much more better using the Da Vinci system. The surgeon can be much more precise, and the accuracy can be much more, rather than having, let's say, an error when doing it manually. So the error percentage using the Da Vinci system is decreased when using laparoscopy, or when performing laparoscopy.
Would you think that practitioners or doctors need more training at performing this sort of surgery versus doing a traditional surgery where they actually have the patients right there in front of them and they use their hands? Sometimes when you use your hand, you have more feeling, and sometimes there's a lot of pressure right there and then because the patient is right in front of you. But when you have a joystick, sometimes, I don't know. What do you think?
I would say definitely it needs training. I mean, using any new device, And since we're dealing with patients, you need to train on almost everything new. However, having a very good background about laparoscopy and how to manipulate, even manually, that would make your life easier when you're training on the new device. I mean, consultants who are seniors in laparoscopy, they will probably face no problem training on the Da Vinci, but taking a fresh graduate, asking him to go on the Da Vinci, that would be a very high challenge.
Do you know why it's called the Da Vinci? Is there a purpose behind this?
I didn't look into it, to be honest, but I believed from my own perspective, or an opinion, let's say, it's because of its high accuracy, or they make it similar to a state of art. They say it's the state of art of surgery.
Okay.
So probably that's maybe where it came from, but I'm not quite sure.
So the Da Vinci is a recent development in the medical field.
Yeah, sure. It's just in the past almost, I think, 7 to 10 years it was there, and it was found just in the developed countries in the West first, and then it came here in Saudi Arabia recently. It is present here in 2 to 3 hospitals, I believe. Yeah.
Okay, so how common is it to find this sort of surgery globally and within the region, would you say?
I would say in the West now, in the States and in Europe, it is present in each country, I would say.
Sure.
But in the Middle East, I would say still we're introducing this technology into the hospitals. And not all hospitals are equipped with the Da Vinci system, but we're hoping that soon we can have this technology because it makes things better for both the patient and the surgeons.
Do you think there are some risks involved with this kind of platform?
Yeah, definitely. Each platform has a risk, and every surgery has a risk. Other than the risks of surgery we talked before about the laparoscopy, I mean, you might guess that the machine might go wrong or anything might happen.
Sure.
But other than that, there is no specific risk. I mean, the risks are involved just with the surgery itself. Other than the machine going wrong, which might happen in any surgery, as you know, no specific risks. On the other hand, it's more accurate. I mean, I would say it decreases the risks. But there is nothing with no risks.
Of course,
That's
definitely.
definite, yeah.
I would imagine that this kind of surgery would be very expensive if you go to a private hospital. So is the extra cost worth doing this kind of surgery versus doing a traditional surgery? Where lots of people do traditional surgeries every day, and things
Fine.
hopefully and by Allah's will go
Yeah.
just fine.
Maybe it depends again on the patient's case. I mean, some patients, they might require doing the Da Vinci. But however, I would say for now, it's life is going okay. I mean, you can perform surgeries, and patients are fine, even doing the classical laparoscopy and the open surgeries. But I would say it's for definite. The Da Vinci system will create new things that we are looking up to, and it would be it's a breakthrough. So at one point, it will make just something that the laparoscopy didn't have as much, and it will, in some surgeries, of course, it will do some advancement. But for now, as far as I know, there's nothing much in difference between, I mean, on the clinical outcome,
Sure.
other than the risks.
I mean, obviously, of course, Dr. Anas, the medical field is always developing and always new techniques are being introduced into the sector. Would you say that the Da Vinci can be used for any kind of surgery, or mainly this is used for certain types of surgeries that require very technical maneuvers?
Mm-hmm. It can be used for the same surgeries the laparoscopy can be used for. So mainly, again, abdominal surgeries, gynecological. But the difference is that it can be used for treatment of some cancers because it has a better view. So
Sure.
sometimes, yes, and that's the difference between Da Vinci and the classical laparoscopy, is that in some types of cancer, the surgeon, if he has the Da Vinci system, might decide to go with the Da Vinci because he might be able to do the same thing he might have done in an open surgery and with the same outcome.
Do you think that the Da Vinci surgical system makes the surgeon unnecessary?
Definitely not. I mean, at the end of the day, you still need a surgeon. You still need someone who's supervising what's happening.
Sure.
Even if you have a complete robotic system which can do the surgery by itself, you still need a surgeon to supervise this because this is patient's life, and we need to be aware of every single move we're making.
So you don't think we're going to come to a stage where you go to a hospital and a robot meets you and they put you in a room, they press a button and the surgery is done.
I hope not.
I hope so as well. I think right now it's about time that we go to our third report, which is about the benefit of laparoscopic surgery. So let's go to this report and we will be back. Stay with us.
Here is three components. For Dr. Munkba's setting is what we call our surgeon console. It's where they actually do the operation. This is what we call our patient cart, or some people refer to this as the robot. This is the operative component of the system, which we kind of call our arms and hands of the system. Where Dr. Munkba's setting, we call it the brains of the system. This is what we call the eyes of the system right here. This is our vision tower, and our instrumentation works to where the doctor is in 100% control.
Once I put my head in, it senses, okay, the surgeon is looking at the camera and can control the instruments. So there you go. And you can look at the monitor. This kind of demonstrates what the thing can do. So you can move it over and put it on there. Grab the penny, move it around. So it's kind of a very neat instrument to allow us to do microscopic procedures. There is a little bit of perception with the hand, but not much. You know, I'm not handling the instrument.
You don't feel it, yeah.
I don't feel it as much, so.
Yeah, this is cool.
Do you do anything with your feet? I noticed the pedals.
So the feet, this one is to focus the camera. This one is to allow my hand to move the camera. It does take longer than open surgery, there's no question about that. As with everything else, the more you do it, the faster it becomes. But the benefit is obviously less pain for the patients, shorter stay in the hospital, faster recovery. It's really quite amazing, the technology that goes in that and all the safety mechanisms. You have to have surgical training because, you know, being able to understand the anatomy, what you have to do, moving the needle driver through tissue, dissecting blood vessels, all that is done through your years of training as a surgeon. Then you go off to a lab where we work on animals and cadavers. And once you go through that, then the FDA gives you a certificate that you've trained on the robot. And once you train on that, you're allowed to start using it on patients, but not by yourself. Usually you have to have a senior surgeon who has more experience on this already. The advantage is really a tool to allow us to operate through small holes. So when you're trying, let's say, to resect cancer of the lung or cancer of the uterus and you're in the pelvis, and you're trying to do it through a tiny incision, you lose a couple of things. One is your vision is gone, so you can't really see through a tiny hole. You have to put a camera in. And the camera here is a three-dimensional camera, so I get depth perception very well, versus just like a TV screen.
I mean, when you're looking in there, you see 3D. You don't
Right.
see what we see. You
Yeah.
see 3D.
So I'm seeing three-dimensional things. I can tell depth of my instrument and such. So then the other advantage to the system is, again, through a small incision, we only have so much room to place instruments. And if you think of if you have an instrument that's really long at the bottom of something and it's going through a hole, you have a small fulcrum. Okay, you can only move it in so many places. What this does is this shaft that's going through here is independent because all the movements are down there. So it allows me to move in a lot more directions, up, down, sideways, without having to make this incision bigger, which is the advantage of robotics versus laparoscopy.
We're back on Up to Date, and with me here in the studio is my guest, Dr. Anas. And in that report that we just saw, we saw a form of the Da Vinci surgical procedure. And to be quite frank, I wasn't expecting to see this kind of social setting during the procedure. So, Dr. Anas, could you tell us what was going on in that report?
So if you're concerned about the social setting, as I explained earlier, the Da Vinci system separates the patient from the surgeon. I mean,
Sure.
each are at different areas. And you're working, the surgeon is working in an area that's non-sterile, or let's say that's not 100% clean. So therefore, he can let people in, that's fine. Because the patient is at the safe area where the instruments are 100% clean and they're sterile, and everything would be fine. However, sometimes in some surgeries, I mean, it depends on the surgeon. If the surgeon sees there is a possibility to let someone of the family in, he might make it happen. But it's always a risk. I mean, sometimes you're afraid because he's not familiar with the setting. You're afraid that he might contaminate your equipments, and therefore you might have an infection or a complication during your surgery.
Right. My only concern was the actual distraction. I wasn't afraid that some of the equipment was going to be infected or anything like that. Or again, do you think this depends on the surgeon himself?
Yeah, again, I mean, some surgeons, if you go into the OR and watch the surgeons working, they work sometimes in a very friendly environment. They keep concentrating, and at the same time, they make life easy and simple. However, some other surgeons, they prefer to be 100% like focused, and they don't need any distraction. They are easily distracted. So again, it's on the person himself. Some surgeons, they can concentrate and keep the surgery going 100% right, and still they can keep chatting. Others, no. They don't prefer this.
Dr. Anas, during the report, we had a side discussion where we talked about that sometimes surgeries can be performed where a doctor is in one country and the patient is in another country. What kind of surgery is this?
This is called a telesurgery or a remote surgery. Mainly, it uses high-speed connections between one country and the other in order to perform surgeries abroad, overseas. So if I'm here, for example, and I need to operate on someone in France because I'm the only one who knows about this case, or I'm the best candidate for this, so I can do this while I'm in Saudi Arabia and the patient is in France. And we can do this through the Da Vinci system that would be equipped with high-speed connections. And therefore, you're physically here, but you're doing the surgery overseas.
Do you think there are more risks involved with this sort of surgery?
I think it has a specific setting. It's not as easy as we're explaining now. There is too much precaution about it, and there would be probably a team.
Standby team.
Standby team in the country where we're doing the surgery. However, it is, I mean, so far it's safe. Yeah, it would be fine. But as I told you, there is some precautions, of course, because this is abroad and you don't know what happens during this procedure.
Are there any high-tech surgeries that we still haven't discussed so far?
Well, the field is open. I mean, in medicine, you have a lot of things developing and a lot of new technologies. Mainly other than laparoscopy, for now in surgery and Da Vinci, I haven't heard of. But, I mean, if we go into other fields, you would find hundreds and hundreds of new things coming up.
Sure. I think there was one terminology that I heard not so long ago called minimum invasive surgery. So could you tell us about this a little bit more?
Well, it's an alternative term for laparoscopy,
Okay.
but it's the broader term.
Sure.
So minimal invasive surgery, it means, as I discussed earlier, just the idea or the fact behind laparoscopy is that you're using small openings or incision into the body rather than opening a very large one. This is called minimal invasive. You're invading the body but with less space or with less areas, and therefore it's called minimal invasive surgery.
Wonderful, Dr. Anas. It's about time that we go out and we take another look at, say, another report that the team has prepared. It's about the laparoscopic gastric bypass surgery. So stay with us for that.
Ready, set, go.
They bounced back so fast from this, it was amazing. With our other labs, they had the big, long incisions, and we had to wait 14 days. And if you can imagine trying to calm something like this down for 14 days, it doesn't work.
This is the blood vessels that we're going to actually cauterize. It's laparoscopic surgery, and we have this ability to make a very, very small surgical incision, and we have the ability to be able to view everything internally with a very tiny camera.
I have a lot better visualization during my surgery, so I can see the whole time everything much better than in a traditional spay. I can make sure, I'm not missing anything. I can make sure nothing's bleeding.
Our goal with anything is to make sure that they're never in pain, and having a laparoscopic procedure really reduces it dramatically. So this is what actually makes all the laparoscopic procedures possible. We're using it mostly for spays, gastropexies.
And this is for large breed dogs that are predisposed to bloating. This is a preventative procedure that we do where we basically tack the stomach to the body wall to prevent the stomach from turning on itself. And the other thing that we can use it for is biopsies, especially like liver biopsies, pancreatic biopsies, things like that, much less invasive and quicker.
There is your belly button, and there, and there is where they did the surgery. And you can see that they're almost the same size. If I ever got another female dog and had to have them spayed, I'd choose the laparoscopy every time. Yeah, it's less pain for you, and makes me feel better.
And we're back on Up to Date, and with me here in the studio is my guest, Dr. Anas. And of course, in that report, we saw a view of a laparoscopic gastric bypass surgery. And I guess you had a look at that surgery, and there was a lot of vets performing surgery. So what's going on there?
Well, in gastric bypass surgery, what we do is that we take the stomach out, and we bypass the stomach and connect the esophagus into the intestines right away. And why we do this procedure is that because some patients, they have excessive obesity, and sometimes the last treatment for obesity might be surgery. And we do this in order to decrease their food intake, because when you have a smaller stomach, your appetite for food would be less. And therefore, we decrease their weight eventually. But we don't do this unless this is the last option available. We try other options such as dieting, healthy lifestyles, but the surgery would be the last option we do.
When laparoscopic surgery first was invented, was it performed on animals before humans? Was it tested?
Yeah, definitely. Everything before we do on humans, we start on animals, and this is how research is built up. Mainly, we start only by by theory, by linking stuff or by building onto stuff that is present before, and then we start working on mice. And then after mice, we start, because they're very, biologically identical to humans. And then we start working on other animals, trying these surgeries and watching the complications, sometimes on chimpanzees or other animals, which are also identical to humans, or they have very good similarities. And then we do it on humans. We start, doing the research on humans, and then it's approved. You can start working on everyone.
Well, obviously, since it's performed on animals first, there's an attempt to try and reduce the risks involved with doing any kind of surgery, let alone laparoscopic surgery. So do you think that there are some complications associated with this form of surgeries, and what are some of those complications that have occurred?
You mean when we perform on animals?
No, when we perform on humans, sometimes complications do happen when you're using this sort of technology. So what kind of complications are most common?
Well, when we do surgeries on human beings, the most common complications we have is infections, because you're at a hospital, and because you're doing a surgery, you have an open wound, and therefore you're more likely to develop any infection. also hemorrhage during bleeding, during the sometimes the surgery or after the surgery. You might bleed or someone might bleed. Also, you have other risk might be, as I told you earlier, is the injuring any adjacent organs or vessels or nerves. Also, and I mean, this is the broad idea about complications. However, if we go into, for example, spine surgeries, they have a specific type of complications that is not present. I mean, that is more likely with them other than other surgeries. But this is the most common complications, usually.
Dr. Anas, I want to thank you very much for being with us on Up to Date and joining us and sharing your views and shedding light into some very difficult terminologies for me personally and for a lot of the viewers. Do you have any final words that you might like to say?
Yeah, definitely. I would like to thank you first and thank the Saudi 2 channel for hosting this great program. Also, I would like to thank my seniors, Dr. Hani Khalifa, who's my senior now currently at Kingdom Hospital, and I would like to thank the family, everyone here. That's a great environment. Thank you very much. I enjoyed the show. Thank you.
And it's about time right now that we go to our final report. It's about colonoscopy procedures. So stay with us, dear viewers, for that report.
Minimally invasive procedures that I perform cover a broad range from removal of the gallbladder, removal of gallstones from the bile duct, removal of cancers of the stomach or small benign tumours of the stomach, resection of colon cancers or segments of the colon for diverticulitis, or segments of the intestine for inflammatory bowel disease. And we now know that it's safer to do it through the laparoscopic approach than through the open incision. Patients can breathe and cough normally after the surgery far more earlier than they can with a large incision, and they're able to mobilise and get out of bed and get back to their normal activities far more quickly.
And we're back on Up to Date, and with me right now is my second guest of the evening, Mr. Wiam Dakishli, who's a training sales supervisor. I would like to welcome you to Up to Date, first of all.
Thank you. Appreciate it.
Being a trainer in sales, could you tell us some of the most updated sales techniques that companies are using today to sell their products or services?
Okay. Now, as in training in sales, currently there are new methodologies in sales. Usually companies are adapting in order to increase their sales.
Sure.
Now, the most important function of any business or any company is the sales, because this is what drives or keeps the company moving. Sales have been transformed through time from being traditional people knocking on doors, showing brochures, then continuing in order to coming to consultative selling. People start to be like more a consultant for the companies, being trusted advisor. And the latest methodology in sales is around knowing the behavior and knowing the, let's say, the psychology of the other people in front of you. So understanding what do the other person think about and how he thinks in order to communicate better and try to understand his needs.
Right. Well, obviously, understanding consumer behavior is a first step to understanding how consumers behave in order to try and offer them services or products that might satisfy their needs. But how does a company find out what the behaviors or the trends are?
This have been done through experience and researches all around the world. Now, psychologists, like they put theories, and people start to take these theories into practice. And after practice, this is what shows if this theory is correct or not.
Right. Well, there's a lot of confusion amongst people between marketing and sales. Sometimes people think that marketing is sales and sales are somewhat different. So could you tell us, is it the same thing or are there differences between the two fields, I guess?
I thank you very much for this question because usually people confuse between these two things.
Sure.
Now, marketing is a tool that complements sales. Usually companies use marketing in order to generate more leads, spread awareness of their product, their company. However, marketing alone cannot perform sales. And sales alone cannot perform marketing, so they complement each other. There are two things that complement each other.
Wonderful. And I think people in sales have more pressure because they had to actually drive in the revenues.
Yeah, exactly. Exactly, because as I mentioned earlier, sales is the main point for each company, which keeps them moving. So if sales is not there, so there will be no finance, no HR, nothing about the company. So
Sure.
this is the main function.
Well, Mr. Wiam, you mentioned that there are a lot of techniques being used in sales. What would you say is the most successful technique in sales?
The most successful one is questioning. Why? Because people buy because of a need. And in order for us to understand this need, we need to ask questions, probe inside, and understand exactly what does the customer want.
Sure.
So this is mainly questioning, which lead us to the direct need of a customer.
Right. What other sales techniques in your training do you also talk about?
We talk about connecting to the customer.
Okay.
Connecting to the customer is very important because usually people buy emotionally. They only take a decision consciously, but they buy emotionally.
Okay.
Let's take, for example, you went to a market and you saw a new car. What do you feel? The first thing you see the car.
It depends what color, I guess.
So it's mostly your emotions.
Sure.
So that's why how to connect emotionally. And another thing is the barrier usually, now people perceive the sales as someone who's coming to take their money.
Sure.
So the first thing they do is they raise a psychological barrier. So
you mean the consumers raise the barriers?
Yeah.
Okay.
For instance, if you are trying to sell someone a big deal, let's say, first of all, you enter to his office, the first move he will do, he will just lean back. This will show you that he built a psychological barrier between you and him to protect himself.
Okay.
So connecting to him and try to remove this barrier is very important part of the sales call.
Wonderful. Well, you mentioned that a lot of people buy emotionally. Why is their buying habits emotional and not practical?
This is relates to the psychology of the human being.
Okay.
Usually people like to have everything they see new. So take it as an example, anyone who goes and see a new, let's say, a new mobile phone in the market, he will have a feeling inside, wow, this is nice, I need to buy it. So the first thing, they become emotional. When he starts thinking really about buying it, he will start considering price, budget, features, benefits, all this stuff. But the first decision taken was emotionally, and this is related to human nature.
Right. Well, you said that sometimes consumers raise barriers between them and the person who's trying to sell them something. Do you think that sometimes salespeople tend to push too much a certain product or a service?
I thank you also for this question because the new methodology in training and sales training is pulling and not pushing.
Okay.
As you can see, if I try to come and push you towards buying something, you will start to be suspicious about me and think that this person is trying to take my money. However, if I understood exactly what are your needs, what you're looking for, what's exactly that you need, in this way I will be your trusted advisor.
Wonderful.
And it will be much more easier to sell.
Right. Do you think that there are sometimes other mistakes that salespeople tend to make? Are there common mistakes between different salespeople?
Well, it's usually related, let's divide it into two parts.
Okay.
Selling mistakes or behaviors mistakes.
Okay.
In selling mistakes, what they do, like the pushing, as we talked earlier, and in behaviors, usually salespeople know what they have to do, but they don't do it.
Why is that?
It connects also to their childhood. Everyone in his childhood, his parents raised him and directed him towards the right path. And sometimes you might hear your mother saying or telling you, don't talk to strangers. This might be the first thing that comes into the back of any salesperson mind.
Okay.
When you are trying to call someone, the first thing comes to back of your mind is don't talk to strangers.
Okay.
So this might stop you from doing what you have to do.
So again, it's all about psychology. It goes back to the salesperson. They might have their own set of
Exactly.
barriers to start with.
Exactly.
Right. Some people have pressure talking to new people. So I guess sales would not be a right fit for them.
Yeah, true. Now, no one is born thinking that I'm going to be a salesman when I grow up.
Okay.
However, it's a profession you take from loving of being around people, showing them new things, similar of what you're doing here, showing new technology and new updates. It's loving of showing the other people new things and things they love to see.
Well, if you had to describe the ultimate salesperson, let's say, what are the skills or the attributes that this person would need to have to become a really good salesperson?
Well, most of all, let me give you in a simple manner.
Okay.
It's the income statement which states who's the best salesperson.
Okay.
In the other hand, salesperson needs to have charisma,
Sure.
needs to have understanding of other people, needs to know what to say and when to say it, and this is very important for the sales.
Do you think that having the right sets of negotiation skills and being very persuasive are also very important?
Exactly. Exactly. Negotiation, let's divide the sales call.
Okay.
So negotiation comes at the end part. So if you need to take a typical sales call, we would start with opening and building relationship with the customer. And the other phase is understanding his needs and what he's looking for. The other one is seeing does what we have satisfy his needs and trying to match our product to his needs. And the other one will be solving any concern that he's having about the product. The last part will be negotiation. And when you reach the negotiation, it's almost a done deal, because usually you won't reach this place if the customer is not convinced with your product.
Wonderful. Well, Mr. Wiam Dakishli, I want to thank you for being with us and joining us on Up to Date and sharing your thoughts on sales and on marketing as well. Do you think, or do you have any final words that you would like to say?
Yes, I would like to thank you for this opportunity, and I would like to say to all the people that training is very important for your lives and for your career progression, so you would be more advanced in your life. And thank you, and thank Channel 2 for this initiative.
Well, this brings us to the end of the show tonight on Up to Date. And of course, today we had a number of very interesting topics. We had a meeting with Dr. Anas, and he talked about the different forms of very recent and developed surgical procedures. And of course, we talked to Mr. Wiam, and he talked to us about sales techniques and what are some of the best ways that a person can sell a certain service or a product. I hope the show tonight has been very helpful and very beneficial and added to our own sets of information. From me, Wari Anizzi, in the studio, I want to thank you again for watching, and I want to thank all the people that worked with us today to make the show a success. Naif Al-Ataybi, Abdulaziz Al-Dos, and Yazid Al-Oudan. A special thanks to all of you. Wassalamu alaikum wa rahmatullahi wa barakatuh.